backs of the hands, much like the neck, are one of the biggest betrayers of a person's age. I mean, you can make a person's face look so much younger, but if the neck looks out of step with the face, or the backs of the hands look out of step with the face, then immediately just about everybody says, their eyes flip from the face to the neck to the backs of the hands and say, she's been done, he's been done. I mean, and it doesn't look right because the face looks young, the neck looks old, the hands look old. So that we're very, very fortunate that up to now, nothing rejuvenated the hands. We used to take care of the color of the skin if there were age spots on it, and if there was some sun damage, we would try to help the backs of the hands. But we had hands that showed veins and showed ligaments and showed tendons, and the thing is that the hands betrayed us, and so it immediately, no matter how good the face, if you look back even 5-10 years when it was fashionable to do, or even 10 or 15 years, you look back at actors and actresses who had facelifts, and you see them sitting and being interviewed, and then you look at the face looked young and pulled like this, and the fact is, but the neck looked old and hangy, and the hands looked terrible, and you said, oh my God, it just doesn't jive, it doesn't go together, it looks so artificial. And nothing could be done because there was no operation. Even if facelifts and eye lifts and neck lifts have become sort of passé in many respects, the fact is there was nothing to be done for the backs of the hands. Nothing until the advent of volumizing fillers. So already for at least a decade, we have been routinely, experienced physicians have been routinely treating the backs of the hands by restoring volume. Now imagine the case. You have a hand that has tendons showing through it. It has blood vessels showing through it. Well, why do the tendons and the blood vessels show through it? What's going on there? Again, I have to emphasize, it's loss of volume. Once you lose the volume, everything else gets exposed. So now the back of the hand is no longer nice and smooth like the back of my hand. It showed up veins and showed up the tendons. So what do you simply do? When done properly, you restore the volume between the areas and a bit into the finger area. You restore the volume, and what happens is it camouflages the blood vessels, it camouflages the tendons just the way the original fat camouflaged those tendons and those blood vessels when our hands were younger. And so the fact is, it's a very simple procedure. There are multiple ways to do it, but the important concept to understand is it takes only 5 or 10 minutes per back of hand to restore the volume to that hand, and you have virtually immediate rejuvenation of the hands with this technique. And then, if you take care of any spots on the surface or any sun damage on the surface, then you have a complete picture of a totally rejuvenated hand.